Enterotoxaemia in goat. Overview. Introduction, etiology, epidemiology, pathogenesis, clinical findings, necropsy finding, differential diagnosis, treatment are included in this presentation. Introductions. Enterotoxaemia is a bacterial disease caused by Clostridium perfringens in sheep, goat and other animals. This organism normally inhabitant in the intestine of the animal species and humans. When the intestine environment is altered by sudden change in diet or other factors, Clostridium perfringens proliferate and cause disease. It is a common fatal disease in the goat. Etiology. Clostridium perfringens, gram-positive non-motile spore-forming toxin-producing anaerobic throat-shaped bacteria. It is an obligate parasite of the ruminant digestive tract. The organism is passed in feces and may persist in soil for long period. There are major 5 types of Clostridium perfringens. Clostridium perfringens A, B, C, D, E according to the toxin: alpha, beta, epsilon, iota productions. Clostridium perfringens type ABCD cause enterotoxaemia, but most common form is Clostridium perfringens type D, enterotoxaemia. Clostridium perfringens type D produce 2 main toxins, alpha, epsilon. Epsilon toxin is the main virulence factors. Epidemiology. Crapine enterotoxaemia have come from Australia, Britain, Canada, France, Sri Lanka and United States. Most outbreaks of caprine enterotoxaemia involved in daily goats raised under intensive or semi-intensive management conditions. Sudden changes in feeding stock or feeding practices have been associated with triggering outbreaks of enterotoxaemia. Specific situations that make goats predisposed to this disease have included to turn out to rush pasture, feeding of bread or other bakery goods, feeding of grain, molasses. Pathogenesis. Clostridium perfringens type D residue in the gut without producing much damage. Sudden intestine of the readily fermentable CHO-rich feed permit undigested starch to pass through the rumen to the abomasal and intestine. Provide more nutrient substrate for rapid proliferations of the organisms. Proliferation more Clostridium perfringens type D and produce more epsilon protein. Epsilon proteins converted into the active toxin by intestinal trypsinogen. Epsilon toxin increase vascular permeability in the gut. Those toxins absorb into circulation and cause generalized toxemia. Toxin absorb into circulation and cause generalized toxemia, pulmonary edema, neurologic signs, fever, renal failure, lethargy, hemorrhagic diarrhea. Clinical findings. The clinical forms per acute, and the chronic. Per acute form, common in young animal, within 24 hours affected. Clinical signs. Sudden loss of appetite, depressions, loud and painful screaming, fearful watery diarrhea, fever, weak and recumbent, abdominal discomfort, arch your back and kicking at belly. Acute form. Similar clinical signs with less severity affect more major goat. Spontaneous recovery occur if not treated. Affected animal died. Chronic form. Intermittent recurring and illness are observed over several weeks. Mature animals are usually affected. Affected goat are dull and listless with reduced appetite and reduced milk productions. Progressive weight loss. difficult to diagnose. Necropsy finding, gait lesions, hemorrhagic, fibrous, necrotic lesions in the gut, fluid accumulate in the blood, pulmonary edema, renal tubular necrosis, edema of the mesenteric lymph node, edema of the brain, pericardial effusions, fatty liver. Differential diagnosis, death of the pre-acute form, all causes of sudden death, diarrhea in acute and per-acute form, coccidiosis, salmonellosis, cryptosporidiosis, colibacillosis, chronic form, chronic salmonellosis. Diagnosis, history and clinical signs, clinical pathology, isolation of bacteria, isolation of toxin, histology. Treatment, prognosis for recovery is gradual, guarded in caprine, enterotoxaemia even with this treatment. Prophylactic treatment, vaccination, specific treatment, commercially available type C and type D antitoxins, remove toxins. Supportive treatment, IV fluid, electrolyte bicarbonate for oral antibiotics. Symptomatic treatment, flunixins, meglumine, 1 mg per kg, intravenously 12 hours. References. Thank you very much for watching my videos.